today you're gonna help me do my job as a nurse, okay? I'm gonna have 5 different patients today. They'll all come in with the same kind of issue. We're gonna be treating hypertension, but we're gonna try different medications.
And obviously you would never in reality give a medication
Right.
you didn't know, but this is just for the purposes of learning the medication.
That's right.
Only disclaimer.
Yes,
That's
disclaimer,
important to say.
exactly
And
right.
also, some of these side effects might not be as quickly, as sudden as we're gonna experience them. But the key, and this is, you know, we wanna have a lot of fun, but the objective of this is to hopefully help us remember what are the common side effects of these classifications of meds, so that we can perform well on our test, and so that we can better look for them when we administer in the real world to real patients, right? So Ted, I understand that you don't want to take another medication, but your blood pressure is dangerously high at this point. So we're going to give you medication A. Okay, the provider has ordered, and let's see what happens. Let's see if it helps.
All right, I'll give it a try.
Okay, all right. We're going to assess our patient and see how our patient is doing, right? After we perform an intervention, we always, what do we do after we perform an intervention? Reassess. Good. All right, so Ted, we're going to check another set of vitals on you.
Yeah, what
Okay? All right. Repeat vital signs in 30 minutes. Blood pressure 92/50. Your heart rate is a little high, 120.
What was that?
Your heart rate is a little, are you okay?
I'm just feeling a little dizzy.
You're feeling a little dizzy.
Yeah. Whew.
When did that start?
Ever since you gave me that medicine.
Ever since I gave you the med. Okay. Anything else that you're feeling?
Well.
Don't get up, okay? I want you to stay in your
all right.
chair.
Okay. Well, could you get me a tissue or something? Because my nose is all stopped up.
And your
I
nose is
knew
stopped.
I shouldn't have come here. I mean, did you give me the flu too? This is ridiculous.
I am wearing my mask.
I know,
And
but
I
where did
wash
I
my
get
hands.
this? My nose is stuffed up and
All right, so
feeling so
identify
dizzy.
any clues that you guys are thinking of? Anything that
Ugh.
Ted is saying that's making you think before we go to the classification? Anything that you need to ask Ted?
Anybody got some nasal decongestant or something?
Sometimes we give medications and we have the best of intentions, and sometimes the patient does really well. Sometimes the patient might experience some side effects or some adverse effects, right? Some symptoms. And so then based on those symptoms, you guys are going to start thinking about which classification of medication this may be that I administered to my patient, okay? When you leave here today, you think about Ted. Think about the fact that you gave Ted, what did we give Ted? Let's see if we remember already. We gave Ted an alpha block, and what did Ted start complaining about? Nasal congestion, right? Okay, good. And what else did Ted complain about?
Dizziness.
Dizzy, good. And what happened to the heart rate? It increased, you see? So just, yes, you're looking at your notes, but hopefully you're gonna remember Ted now, or Professor Berro as Ted, and you'll never be able to look at her the same again.